Thank you everyone for joining us today. My name is Lori Marie Pashota, and I'm the Education and Outreach Coordinator at NeedyMeds. NeedyMeds is a national nonprofit, and we connect patients with programs all over the country that will help them pay for their healthcare expenses, including prescription medications. Today we have a special webinar topic. The title is Lowering Costs for Type 2 Diabetes Care. Diabetes affects about 30 million Americans, and it costs the United States upwards of $245 billion per year. And in observance of National Diabetes Month, which was actually in November, this webinar had to be rescheduled. Public Education Project Consumer Reports Best Buy Drugs will co-host today's webinar discussion, and will talk to us about the growing cost of type 2 diabetes care, and they'll also offer tips on how patients can save money on diabetes medications. Before we begin, I just want to touch on a couple of housekeeping points. Everyone will remain on mute for the duration of this presentation. Should you have any questions for our presenter or for me, please type them into the questions bar in your control panel. We'll answer your questions at the end. This webinar will be recorded and will be placed on our webinar library page and also our YouTube channel. And at the end, both our guest presenter and I will provide our contact information. And if you would like to request a copy of the slides, our presenter will provide her contact information for that as well. So without further ado, I'm delighted to introduce Ginger Skinner. Ginger is a health writer for Consumer Reports Best Buy Drugs Project. It's a public education project dedicated to helping people talk to their doctors about prescription drugs and helping patients find the most effective and also the safest drugs for the best price. And so without further ado, I'm passing the mic over to Ginger. And in just a moment, I will make Ginger presenter.
Okay. Thank you, Lori.
You're welcome.
Hello, everyone. I'm really pleased to be here and to be the presenter and working with NeedyMeds to share this information with you today on lowering costs for type 2 diabetes care. I want to say a lot of what I'm going to cover today, if you have diabetes, it might seem like common sense at first, but bear with me. There will be some aspects that might be completely new to you. For instance, a lot of the information that has to do with the rising cost of diabetes. Type 2 diabetes is one of the most serious medical conditions in the U.S. today. The number of people who have it has been rising at alarming rates. So let's get into the numbers to start off. So here's a snapshot of diabetes in the United States, and these numbers were provided by the Centers for Disease Control and Prevention. Approximately 29.1 million Americans have diabetes. So that's around 9% of the U.S. population, and about 1 out of 4 of those are undiagnosed. About 86 million Americans, and that's more than 1 out of 3 adults, have a condition known as prediabetes. 9 out of 10 of those aren't aware that they have it. So what prediabetes is, it just means that your blood glucose levels are higher than normal, but they're not yet high enough to be diagnosed as diabetes. People with diabetes are at a much higher risk for certain health problems, and I'll give some examples. You can see some here. More than 500,000 American adults have advanced diabetic retinopathy. That greatly increases your risk for blindness. Diabetes also causes nearly 50% of all cases of kidney failure. People with diabetes are about twice as likely to be hospitalized for a heart attack or stroke And more than half of all amputations of toes, feet, or legs occur in adults that have diabetes. So it's really, really important that if you have risk factors that you see your doctor right away to be tested for diabetes. Some of these risk factors, and some of the more common ones rather, are being overweight or obese, having a family history of diabetes, and being 65 years or older. Also, if you're pregnant, some women are at risk for diabetes or develop diabetes during pregnancy, and that's known as gestational diabetes. If you look at this page closely, you can see that the CDC offers a diabetes risk test, so you may want to check that out. If you visit www.cdc.gov/diabetes, you can assess your own risk. But of course, for a diagnosis, you'll need to see a healthcare provider. Now let's talk about the cost, the growing cost. More than 1 in 10 healthcare dollars in the U.S. are spent directly on diabetes and its complications. And as Lori said in the beginning, as of 2012, the total healthcare cost for diabetes in the U.S. is roughly $245 billion. That's an increase of 41% since 2007. That number includes doctor visits, hospital and emergency room care, medications, and loss of work and wages for people with diabetes. And according to the American Diabetes Association, a person who has diabetes spends on average $13,700 per year on their care. Another stat you can see here on this slide is that medical costs for people with diabetes are twice as high as for those who don't have the condition. And let's dig a little deeper into what the burden of these costs can do to the individual. Studies have shown that health costs, such as the cost of medication, are a major burden for Americans. There's been numerous studies done over the years. We know from a recent poll that we did that when people can't afford their care, they take actions, and some of the actions can be dangerous ones, such as putting off a doctor's visit or a medical procedure because of cost, or even not taking a dose of medication or skipping filling a prescription because it just costs too much. So today we're going to deal mostly with type 2 medication costs and what you can do to bring them down. For starters, I'd like to talk about our project. It's Consumer Reports Best Buy Drugs. It's a public education project that offers unbiased, evidence-based drug information, and it provides you with a trusted resource for help in choosing the best, most affordable medicines. The project informs you about drug choices. It provides recommendations known as Best Buys based on safety, effectiveness, and cost. And it also helps you talk to your doctor or other healthcare providers about your conditions and about the best medicines for you. So how do you get started on learning more about Best Buy Drugs? You, of course, visit our website. If you visit www.crbestbuydrugs.org, you'll see a page like the one in front of you. If you look at the left column, you'll notice there's a number of conditions that we offer recommendations and expert advice on, and one of those is diabetes. If you click on diabetes, you'll come to a page like this, Best Treatments for Type 2 Diabetes. This is an online report on the full scope of detecting and treating diabetes, from your symptoms to medication basics to drug safety and side effects. There's also a cool video here that you might want to watch. Key parts of this report are the drug comparisons, and this is a drug comparison page that you'll come to if you visit the report. The report looks at 6 classes of diabetes drugs, or 12 individual drugs, and with the help of the Johns Hopkins University Evidence-Based Practice Center, the Drug Effectiveness Review Project, also known as DERP, and a number of other scientific and medical groups, It compares the safety, adverse effects, dosing, effectiveness, and cost of each drug. And then it arrives at Best Buys, which I mentioned previously, and those would be our top recommendations. Here's an example of some advice we would provide. If you and your doctor determine that your diabetes needs medication, then we recommend trying metformin first. It's a generic and a low-cost one. A strong medical consensus has emerged in our country, in Europe, and Australia that most newly diagnosed people with diabetes who need a medication should first be prescribed metformin. Now, if metformin fails to bring your blood glucose into the normal range, you could then talk to your doctor about introducing a second drug. And those two are also Best Buys. Those are recommendations that we make in our report. And those drugs are glipizide or glimepiride, and those are good options. Now, our reports also provide some practical treatment advice and other need-to-knows, and here are some examples. One is that newer drugs are no better. Several of the newer drugs that treat diabetes, such as Januvia, do not lower blood sugar as well as the older generic drugs like metformin or glipizide. Another recommendation is that newer drugs are no safer. All oral diabetes drugs come with side effects. For example, low blood sugar, weight gain, and swelling in the legs and ankles. However, older drugs have been around longer, so the side effects are better known. Two of the newer drugs, Actos and Avandia, you may have heard of those, have been linked to higher risk of heart failure and bone fractures, so those are pretty serious. Also, newer drugs are more expensive. The newer diabetes medicines cost many times more than the older drugs. For example, drugs like Starlix and Januvia cost around $282 per month, whereas metformin and glipizide will cost you only around $4 to $35 per month. Finally, taking more than one diabetes drug is often necessary. Many people with diabetes do not get enough blood sugar control from taking just one medicine, so two or more may be necessary. However, you should note and you should discuss thoroughly the risk with your doctor, because the more drugs you take, the higher your risk of adverse effects, and of course it increases your cost. So if your doctor just writes your prescription, make sure you question it and you talk through thoroughly how much it's going to cost you and what the side effects might be. Another great resource, of course, many of you may know about, is NeedyMeds. By typing the name of your drug, your diabetes drug, into the NeedyMeds drug search box, you'll come to a list of patient assistance programs that you may be eligible for, along with information that you'll need to sign up for it. NeedyMeds also offers diabetes-specific assistance, offers information on diabetes-specific assistance programs. These programs can help you pay for care, medications, and supplies. And then there are some other more general ways that you can lower costs. Here's a really interesting slide, but this is probably one of the most important things you can do to lower costs before you even have a prescription for a medication, is that you should talk to your doctor about cost. Don't wait for your doctor to bring up cost, because 9 times out of 10 he or she may not. Instead, ask also about generics, whether you can stop taking drugs that you no longer need, and whether it's safe to split your pills in half. So thoroughly discuss all your treatment options with your doctor before he or she hands you a prescription. Your pharmacist may be able to help you too. So ask your pharmacist for the lowest possible price on your medication. In fact, every time you fill a prescription, whether it's for diabetes or another condition, make it a habit to talk to your pharmacist about lowering your drug costs. Your pharmacist, a good pharmacist, should be able to explore options for you. For example, your pharmacist might offer a prescription discount program that can make your drug cost even less than they would if you used your health insurance. Another tip is to keep tabs on your blood sugar. If you use insulin, your doctor may suggest you check your blood sugar regularly to keep it under control, which can lower your risk for complications, which can lower your long-term health costs. Some companies will even give you a blood pressure meter for free if you buy the test strips. The test strips can be sort of pricey. Also, check with your local drugstore on whether or not they offer a glucose meter and whether you can get it for free with a rebate. So again, these are questions you can ask your pharmacist. And also work with your doctor to figure out how often you must test to achieve your best glucose control. This is almost number one, but I moved it down a little further because I was talking mostly about medication, but this is one of the most important things you can do to keep your costs down long term, and that's just to make healthy lifestyle changes. That means eating healthy, losing weight if you need to, and getting regular exercise. Lifestyle changes, studies show that lifestyle changes can be just as effective or even more effective as medication, especially in the early stages of diabetes. And of course, they can result in lower long-term medical costs from, for instance, insulin and other injectable diabetes drugs. They may make it so that you don't need those additional treatments. A lesser-known benefit many insurance plans offer is a disease management program for people diagnosed with type 2 diabetes. That means that you can get access to a personal health coach who can help you navigate the medical system to care for yourself and manage your illness. So if you're not sure whether your health plan offers this, just give your HR department's benefit manager a call. And again, I like to say, finally, when it comes to saving money long term with diabetes, it's, take care of yourself now. Don't delay. Get to the doctor. Keep your doctor's appointments. Always talk about cost. Stay healthy. Do what you need to do as far as lifestyle changes go, but don't wait, because the longer you wait, the more complications you may have. So that pretty much wraps up my discussion, and I want to end on this page just to share our website with you. It's www.crbestbydrugs.org. We're also on Twitter and Facebook, and we also have a monthly free e-newsletter that you can sign up for. And the last bullet here is my contact information. If you have questions and maybe you don't want to ask them right now, or if you want to think about it and contact me later, feel free to reach out. I can also, if you need a copy of this slide presentation, I can send you a PDF of it. My email address is gskinner@consumer.org. And now I'll pass the mic back to Lori and take some of your questions if you have any. Thank you again.
Thank you so much, Ginger. That was a wonderful presentation, and I, for one, certainly learned a lot. I just want to quickly point out to people on the NeedyMeds website, we have a couple of ways that patients can also save money on diabetes care. In addition to, as Ginger showed you, the PAPs, which are pharmaceutical prescription assistance programs. There are other resources as well. So this is the NeedyMeds homepage, and if you go under Patient Savings tab, Ginger already showed you where you'll find prescription assistance for brand name as well as generic name drugs. She showed you a screenshot of that. You could also just simply type the name of your drug, for example, metformin, here in the drug search box. Another way patients can save would be to go to coupons, rebates, and more, and you could search by category. And so if we scroll down, we'll see that there's a page for diabetes care. And here you'll find a listing of coupons and rebates for things like testing strips and glucose monitors and so on. So you can scroll down and see other coupons that may be available to you. Most of these links will take you directly to the manufacturer's website.
That's great. Those are great. I didn't know those existed.
Absolutely, absolutely. We try to be as comprehensive as possible. Also, if you go back to the Patient Savings tab and you look in the Diagnosis Specific section here, you can search for assistance with for healthcare costs other than medications by searching by a diagnosis or condition. So if we click on D and we scroll down, we see that there are resources available for patients for diabetes in general, juvenile diabetes, and then other complications from diabetes. So you can search, for example, for programs around the country that might provide medical services or testing for visual conditions associated with a diabetes diagnosis. So again, you want to go to the NeedyMeds homepage, click on Patient Savings, and that's where you'll find help with medications, coupons and rebates, as well as costs associated with diabetes other than medications. And we also, of course, have a listing of camps and retreats and also scholarships where you can search by a diagnosis of diabetes and see what's available to you as well. So that's NeedyMeds. At this time, I think it makes sense to take some questions from the audience. I see we already have a few. Ginger, I don't know if you can speak to this. The question is, why is insulin so expensive in the first place? And I can tell you that our helpline operators at NeedyMeds receive the most calls for insulin and other medications associated with diabetes. Do you know why insulin is, in fact, so expensive?
I wish that I could answer that question. I'm not sure. Let's see. I may be able to check our website for more on that.
Okay. Well,
yeah, I'm not really sure. That could be something that if that person wants to email me separately, I can provide some additional information on the cost of insulin and why it's so expensive. I think that's a question that plagues many, and one that I wish I had included in my presentation. So feel free to email me, and I'll do what I can to answer that question.
Okay. Let's see. One question for you, Ginger, from a member of our audience. Amy would like to know, how do you keep up with changing drug prices when you're determining the best buys?
Well, we update regularly. So we're constantly, so it's not just, we work with a team of people. We work with the Drug Effectiveness Project. It's an organization out of a research organization in Oregon. We work with a number of hospital groups and medical groups. So, and we also work with a number of, it depends on what we're looking at. So for diabetes, it may be we work with certain organizations, and for, say, fibromyalgia, we work with other organizations. So we're constantly updating them as they're updated.
Pardon me, Ginger, I think that your audio is fading out a little bit.
Can you hear me now?
Yes.
Okay, I may have moved the phone. I apologize. We are I wanted to just add that we're constantly looking at prices and updating them, and the organizations we work with to compile these reports provide pricing updates for us. So there may be times that we can't account for overnight price changes, but we try and update these important reports. For example, our diabetes reports and our reports on statins and high blood pressure. We pay special attention to those reports and make sure the prices are up to date.
Okay, thank you. Another question we have here is, do we have to have a subscription to Consumer Reports to get the drug report information?
No. Best Buy Drugs started out as, I guess it continues, but I shouldn't say started out as, because it continues to be a public education project, and it's all the information on the Best Buy Drugs website is completely free. And I want to say that you can access the Best Buy Drugs website just by going to, you can either use this link that I've provided, but you can also reach it by going to consumerreports.org, clicking on health, and then clicking on drugs. And all of the information is completely free. There's, in addition to the information you'll see on your screen, there's downloadable PDFs that are for different conditions, and those tend to be really lengthy, around 30 pages, but if you have a condition, research has shown that if you have a condition, you want to know everything about it. So those reports can be downloaded, printed out, and you can take them to your doctor and discuss our findings with your doctor. And everything's free.
Great, thank you so much. A question is, can a patient who has prescription coverage use the coupons that I showed you? The coupons, you have to read the fine print of each coupon. Some of the coupons are available for perhaps a free sample or a mail-in rebate. The manufacturer determines the rules for those coupons. So if you currently have insurance coverage, you may or may not be able to use those coupons. You just have to look at the specific coupon in question. Here's another question. Does NeedyMeds provide any health insurance counseling to individuals who are experiencing high medication and healthcare costs due to underinsurance? No, we do not provide health insurance counseling. We're an informational resource that will connect patients to programs that will provide financial assistance. But we do not offer any financial assistance, nor do we offer counseling about which health insurance coverage programs individuals should purchase. You would probably want to look at your state's resources for that. There are probably nonprofits in your community that do that as well. In Massachusetts, we have an organization called Healthcare for All, and they will actually take the time to look at a patient's current insurance plan and their income and figure out what they're eligible for. So there's probably something like that in your state as well. You just might have to do a little bit of research on the internet to find out what the name of that organization is. But no, that's not NeedyMeds. That's not what we do, unfortunately.
We also, we don't offer that type of counseling, but if we offer health insurance information on Consumer Reports website, also under the Health tab. And if you were to visit our website and click on the Health tab, you would see information on a tool we have called the Health Law Helper, which can help guide you to the right insurance for your income level. So I recommend, if you're doing some research, check out our website as well and see our advice on health insurance.
And again, someone asked how they can get a PDF of your slides. You can email Ginger at her email address, which is listed at the bottom of the slide, gskinner@consumer.org. Let's see, I'm just reading through the questions. Please bear with me a moment. This question is for you, Ginger. What is Consumer Reports' opinion or stance about Walmart's insulin brand Relion, R-E-L-I-O-N? I'm not sure if I'm saying that correctly.
I don't know much about that drug. Let's see. Can you spell that again?
Sure. The name of the insulin brand is R-E-L-I-O-N.
Let's see. Well, here's one thing I should say, and I don't know if this is probably not very good a helpful answer, but we don't do ratings on insulin. I don't know if we will in the future. Right now, our Best Buy drug ratings are limited to oral medications. So I can't actually looked it up, and then it hit me that, oh, we don't rate those. We do, however, review blood glucose meters by that same brand. So I'm sorry I can't answer that question.
That's quite all right. Thank you for your effort anyway. Someone is asking, where on the NeedyMeds website can they find the link for the generic medication program that is being funded by NeedyMeds and RX Outreach? Well, you could either search for the specific generic medication that you're looking for, and you would just, look at the alphabet bar and go for it that way. But if you want to see the complete listing of medications covered by this particular program, which we call GAP, Generic Assistance Program, you would go to Patient Savings tab, and then under Prescription Assistance, click on Program Name, and then under Program Name, click on G for Generic Assistance Program. And then when you pull up Generic Assistance Program, it'll take you to the application for it, and it will also contain a list of all the generic medications currently offered in this program. I'm just reading through questions. Someone says, thank you, and thank you for their presentation. So thank you,
welcome.
Ginger.
Thank you. Thank you, Lori. Thank you, everyone. You're welcome.
Someone is asking if this will be recorded. Yes, it is being recorded, and it will be placed on our webinar library page by the end of next week. You can find the webinar library page by going to the NeedyMeds website and clicking on the Getting Started tab at the top. And when you click on Getting Started, it'll pull down a menu. Just click on Webinar Library page, and you'll see all the special topic webinars we've had in the last year or so. Okay, last call for any questions for Ginger Skinner while we have her. Anyone? Anyone? Okay. Well, thank you so much, Ginger. I appreciate your taking the time to talk with us today. I, for one, learned a lot, and I think other people did as well.
Thank you. And again, if I can provide any additional information, I know sometimes it's hard to come up with your questions in a live sort of atmosphere, so I'm available through my email address, and I'm happy to, if I can't answer your question, I'm happy to point you in the right direction.
Well, thank you so much. We really appreciate that. Your caring and concern for patients all over the country really comes through in the way that you've given us these resources today, and we appreciate your willingness to be open to future questions. And thank you so much for your help and your guidance. And NeedyMeds is really proud to have a partnership with Consumer Reports, and we actually help Consumer Reports distribute their Best Buy drug booklets. If you would like a Consumer Reports Best Buy drug booklet, you can of course get one from Consumer Reports directly, or you can feel free to go to the NeedyMeds website and request a copy of that as well. There's no charge for that on our end. So thank you again, and we appreciate your being here today. We have a couple of other webinars coming up. Later in December, we're going to have a special topic webinar on PrEP, which is pre-exposure prophylaxis for HIV/AIDS prevention, and that will be in honor of World AIDS Awareness Day in December. And we'll also, of course, have our monthly overview webinar. If you want to learn more about NeedyMeds and the different resources on our website, tune into our overview webinar. You can sign up for both of these upcoming webinars by going to the NeedyMeds homepage and click on the Getting Started tab, and then click on Webinars, and you'll see registration links for both of those webinars. So thank you again for joining us today, and have a wonderful day. We'll speak with you again very soon. Bye-bye. Take care.